Extract 1. Questions 1 to 12. You hear a doctor talking to a patient called Tainatongo. For questions 1 to 12, complete the following notes with a word or short phrase. You now have 30 seconds to look at the notes. Hello, doctor. Good morning. Good morning. What's your problem? Well, doctor, I have intolerance to allergies, inhalant and environmental allergies. What's your age? 36. Okay, do you get any kind of reactions like an itchy rash, throat or tongue swelling, shortness of breath, vomiting, lightheadedness, and low blood pressure? Clinically, these symptoms show the presence of anaphylaxis. No, doctor. Or else, do you get itchy red welts called angioedema that develop on your skin? No, doctor. Are you taking any medication for allergies? No, doctor. May I know your past medical history? 6 months back, when I was under dialysis due to renal failure, I had an acute event of perioral swelling, etiology uncertain. The diagnosis results showed that the allergic reaction was due to Keflex that was used to treat a cellulitis dialysis shunt infection. What medications are you taking now? I am taking atenolol for controlling my blood pressure, sodium bicarbonate, Lovatsa, and Dialovite. I didn't have any other issues upon my treatment and discharge that included corticosteroid therapy and antihistamine therapy and monitoring. What were the surgeries performed? Perm cath insertion 3 times and peritoneal dialysis. Are you allergic to any medications? Yes, heparin causes thrombocytopenia. Do you drink or smoke? No, doctor. May I know your family history of diseases? My family members have severe heart disease, carcinoma, and food allergies. Well, your test report shows your blood pressure is 128/78, pulse 70, temperature is 97.8, weight is 207 pounds, and height is 5 feet 7 inches. I suspect you have developed acute anaphylaxis. I would suggest you to go for a radioallergosorbent test, a blood test using radioimmunoassay test to investigate specific IgE antibodies to determine the substances the subject is allergic to. I shall recommend further treatment and medications upon the test results. If the test report shows any specific food or inhalant allergen that is found to be quite high on the sensitivity scale, I would likely recommend that you avoid the offending agent. Right now, I would recommend you to stop further usage of cephalosporin antibiotics, which may be the cause of your allergic reaction, and I would consider your case as an allergy. Being on atenolol, it would be very difficult to treat acute anaphylaxis. I am prescribing an EpiPen in the event of acute angioedema or allergic reaction or sensation of impeding allergic reaction, and you have to proceed directly to the emergency room for further evaluation and treatment recommendations after the administration of an EpiPen.
Extract 2, questions 13 to 24. You will hear a local GP talking to a patient called Paul John. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good morning, Paul. How are you doing today?
Oh, hello, Doctor.
Well, I see that you've just had heart surgery for a repair of an aortic aneurysm and now have a mechanical heart valve in place.
Yes, my surgeon advised me that I set up contact with a local GP for follow-up care, so here I am.
Yes, your thoracic surgeon, Dr. Goodhands, has forwarded me your case history, but it appears you've made a very good recovery.
Well, I hope so.
Now, before we talk more about managing your recovery, I'd like to get a few personal details from you if you don't mind.
Okay.
So, how old are you?
32.
And where are you from?
I'm from China.
Okay, and are you married?
No, I'm single.
And where are you living now? House or apartment?
I'm sharing a house with some other students.
Okay, and what are you studying?
I'm doing a PhD in IT.
So you're quite busy here in Australia.
Yeah, that's right.
And how is your study going?
Okay, I'm enjoying it, but it's pretty intense.
So a bit of a stress involved with your study?
Yes.
I see. Now a bit of information about your medical history.
Okay.
Do you suffer from any allergies?
No.
Any past surgical history?
I had my tonsils removed as a boy.
And apart from that?
No.
How about your blood pressure?
It's been high since 2009.
Is there any family history of illness?
Well, my father died of a stroke when he was 45.
I see. Do you drink?
Not much. Sometimes on the weekends.
What about smoking?
Not now, but I used to smoke about 10 to 15 cigarettes a day.
And what's your current weight?
95 kgs.
And your height?
I think I'm about 178 centimetres.
When was your operation exactly?
2 weeks ago, the 2nd of September actually.
Okay, let me check your blood pressure. Good news. It's 110/70.
Oh, good.
Pretty soon we'll be able to start weaning you off some of the blood pressure lowering medication.
Well, that'd be good.
And how is your diet at the moment? Are you being careful with what you eat?
Yes, I've managed to reduce salt in my diet and I'm trying to lose some weight.
Good. And are you doing any exercise?
No, I'm afraid to do anything too much at the moment.
Okay, I understand. But you could now start with some gentle walking or other forms of mild exercise. Just be sure you don't lift heavy weights.
Right.
And there is a very good cardiac exercise program that I advise you to join. It's run by the Cardiac Rehabilitation Unit at the Spirit Hospital. So I'd recommend you contact them.
In this part of the test, you will hear 6 different extracts. In each extract, you will hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You will have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
You hear a doctor and a trainee discussing the application of a plaster cast.
So let's discuss the short arm cast that you're going to apply. What are the steps?
Well, first, I need to examine the area and check the x-rays to see if surgery is needed. For the cast, first I'll apply a stockinette with a hole for the thumb, and then I'll wrap the arm in a web drill for padding. After that, I need to immerse the roll of plaster in water.
Right. And what should you point out about the plaster?
I need to warn the patient that it may feel hot as it starts to set. How long does it take to dry?
The cast may feel dry to the touch in a few minutes, but it isn't fully dry for 72 hours. What's the last step?
After I've applied the cast, I need to take another x-ray to confirm that the fracture has been reduced.
You hear a manager explaining new data management processes to clinical staff.
Yes, in the back. You had a question?
Yes. How should we file our feedback reports? Do we need to just complete them on the computer?
That's a great question. Remember that since the clinic has begun transitioning to the new computers and software systems, we need you to fill out the paper reports in addition to the digital versions. I know this may be time-consuming, but this is because as we transfer all our files from the old servers to the new ones, some files may be misplaced, and we want to ensure that all of our records are easily accessible at all times.
So we need to make 2 copies of our reports?
Yes, exactly. Great. Does anyone else have a question?
You hear a presentation about the introduction of a new type of wound dressing.
Thank you all for coming. Well, after some research, the hospital has decided to invest in a new type of dressing to care for our patients with chronic wounds, such as those with diabetic ulcers. Although the traditional cloth compression bandages are useful, they need to be changed frequently to promote healing. These new bandages are made of a natural plant-based material instead. In fact, they're made from seaweed. Alginate dressings are somewhat costly, but they can prevent harmful strains of bacteria from entering the wound by forming a protective barrier with the skin. Most impressive of all, they can absorb up to 20 times their own weight, so they're the best choice for wounds with high-level exudate. Based on these factors, we believe that alginate dressing would be a useful addition to our wound care procedures.
You hear 2 hospital managers discussing completion rates for an online course.
It looks like only around 40% of the staff have completed the online health and safety course so far.
Less than half, but the course has to be completed by all staff members by the end of the month. Can we send them a reminder email?
We've reminded them by email twice already. I've even phoned a few people. I think we need to bring it up at the general staff meeting next week.
That's on Thursday afternoon, right? Will that work with everyone's schedules?
It should. All staff members have that time already blocked out. But if anyone can't come, then we can speak to them in person one-on-one.
You hear an educator describing methods for creating medical abbreviations to nursing trainees. A technical name for the use of first letters is initialing, but I prefer to use the phrase the first letter rule for this method. Abbreviations using the first letter rule commonly identify diseases and diagnostic tests. For example, chronic obstructive pulmonary disease is COPD, or liver function tests are LFTs. In most cases, these letters are pronounced separately, as letters, but sometimes key letters or key syllables form the abbreviation. For example, hypertension is abbreviated using HTN, or we see the term atrial fibrillation abbreviated as either AF or AFib. Sometimes the first letters form an easily pronounceable word, an acronym. For example, acquired immune deficiency syndrome becomes AIDS, or severe acute respiratory syndrome becomes SARS. Understanding these principles will help you to more quickly learn the many abbreviations used in local clinical settings. You hear 2 colleagues discussing an online training course.
Hi Fiona, how are you? Can I ask you something?
Sure, Mug. What's up?
Have you done that online training for a new record management process?
Yeah, I did it on the weekend. It was supposed to take 10 minutes, but it took me ages.
Did you have any trouble with it? I mean, any technical problems?
Not really. I couldn't log in for a bit, but that was just me getting my password wrong. After that, it worked fine. Why?
I keep getting this email that says I haven't finished all the activities, and then when I log in, it says I've completed everything. It's driving me crazy.
Did you ring the IT help guys?
Yeah, they reset it, but it didn't do anything. I really don't want to do it again.
No, you shouldn't have to. Maybe just send the register an email and let her know that you've done it. Maybe she can fix the issue.
That is the end of Part B. Now, turn over and look at Part C.
Part C. In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about specific aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete the answers as you listen to the audio. Now, look at Extract 1. Extract 1, questions 31 to 36. You hear the lecture given by a physician on colectomy surgery. You have 90 seconds to read questions 31 to 36.
Hello, doctor. Please explain to me different types of colectomy surgery.
Well, the surgery to part of or all the colon or the large intestine is called a colectomy, and there are many types of colectomy surgeries. The type of surgery and how much the colon is removed based on the disease and the extent of damage to the large intestine. In the proctocolectomy, the colon is removed along with the rectum. The term procto refers to rectum. With both the colon and the rectum removed, the body will need a new way to dispose of stool. For most people with inflammatory bowel disease, either ulcerative colitis or Crohn's disease, a proctocolectomy also means the creation of an ileostomy. When part of the small intestine is brought through the abdomen to create a stoma, it is called an ileostomy. Therefore, the stool can be passed through the stoma and is received in an ostomy device worn on the outside of the body. The ileostomy can be temporary or permanent. J-pouch surgery is an ileal pouch anal anastomosis. which is done along with proctocolectomy or after proctocolectomy. In this surgery, the last part of the small intestine, called the terminal ileum, is sewn together in the shape of a J and can then hold stool for a period of time, serving like a rectum. Ileoanal anastomosis is done to restore the ability to move stool through the anus. In this surgery, after the rectum and colon are removed, the small intestine is connected directly to the anus. In the total colectomy surgery, entire colon will be removed. Unlike proctocolectomy, the rectum is not removed in this surgery. A total colectomy with partial or complete rectum left in place may be done in certain cases of either Crohn's disease or ulcerative colitis. In a partial colectomy, part of the colon is removed, and it may also sometimes be called a subtotal colectomy. A partial colectomy may be done for certain patients with Crohn's disease, while it is also done to treat colon cancer or diverticulitis. This surgery is never done for the patients with ulcerative colitis, since the disease will often recur in the healthy section of the colon that is left. In hemicolectomy surgery, either the left or the right part of the colon is removed. In a right hemicolectomy, the cecum, ascending colon, and a portion of the transverse colon are removed, along with the appendix is attached to the ascending colon. Whereas in a left hemicolectomy, the descending colon and part of the transverse colon are removed. In this surgery, typically the healthy sections of the colon are connected together. Therefore, an ostomy is not required.
Now look at extract 2, questions 37 to 42. You hear the doctor giving a lecture on tests used on biopsy and cytology specimens to diagnose cancer. You have 90 seconds to read questions 37 to 42. Usually, the grade and type of a cancer is clear when the cells are observed under a microscope after routine processing and staining. However, this is not always the case. At times, the pathologist requires to use other procedures also to diagnose the cancer. Histochemical stain tests use various chemical dyes that are attracted to certain substances in some types of cancer cells. For instance, the mucicarmine stain is attracted to mucus. Droplets of mucus inside a cell exposed to this stain will look pink-red under a microscope. This stain is useful if the cancer cell is suspected for an adenocarcinoma in a lung biopsy. Adenocarcinomas can produce mucus, so by detecting pink-red spots in lung cancer cells, pathologists will decide if the diagnosis is adenocarcinoma. Besides being helpful in sorting out different kinds of cancer tumors, Other types of special stains are used in the lab to identify microorganisms, such as fungi and bacteria in tissues. This is significant because the cancer patients may develop infections as a side effect of treatment, or even due to the cancer itself. It is also essential in cancer diagnosis because some infectious diseases cause lumps to form that can be confused with a cancer tumor until histochemical stains prove that the patient has an infection and not cancer. Immunohistochemical stains or immunoperoxidase stains are another significant category of diagnosis. The basic principle of this procedure is that an immune protein called an antibody will attach itself to antigens, which are on or in the cell. Each type of antibody identifies and attaches to antigens that fit it exactly. To find out whether the antibodies have been attracted to the cells, chemicals are added that make the cells change color only if a certain antibody is present. Immunohistochemical stains are very useful in diagnosing certain types of cancers. For instance, a routine biopsy of a lymph node may contain cells similar to cancer. However, the pathologist may not be able to distinguish whether the cancer originated in the lymph node or elsewhere in the body and has spread to the lymph nodes. In case the cancer originated in the lymph node, the diagnosis would be lymphoma. Or else, if the cancer originated in another part and spread to the lymph node, it could be metastatic cancer. This distinction is very essential because treatment depends on the type of cancer. Often, flow cytometry is used to diagnose the cells from lymph nodes, bone marrow, and blood samples. It is very precise in diagnosing the exact type of lymphoma or leukemia. It also helps distinguish lymphoma from non-cancer diseases in the lymph nodes. Flow cytometry is also used to measure the amount of DNA in cancer cells called ploidy. Instead of using antibodies to diagnose protein antigens, cells are treated with special dyes that react with DNA. If the DNA amount is normal, then the cells are said to be diploid. If the DNA amount is abnormal, the cells are categorized as aneuploid. Aneuploid cancers of most organs tend to grow and spread faster than diploid ones. Another significant purpose of flow cytometry is to measure the S-phase fraction, which is the percentage of cells in the sample that are in a certain stage of cell division, called the synthesis or S phase. The more cells in the S phase, the faster the tissue is growing and the more aggressive the cancer will be. Like flow cytometry, image cytometry tests use dyes that react with DNA. However, instead of suspending the cells in a stream of liquid and analyzing them with a laser, this method uses a digital camera and a computer system to measure the amount of DNA in cells on a microscope slide. Image cytometry can also determine the ploidy of cancer cells, like flow cytometry. This is the end of Part C. You now have 2 minutes to check your answers.